I'm Alita. I'm a dietetic assistant at Metro North Health and a PhD candidate for Griffith University from Australia. So, what can be done to improve the number of people who receive simpler 6 actions? Changes can target increasing the capability of health workers, patients, and carers through better knowledge, skills, and understanding. It is also important to create opportunities to make the right thing to do easier to do. Finally, it is important to consider improvements that motivate people to do the right thing. Over the next few slides, we will give examples of lots of different improvement ideas. Some of these will be very helpful in your setting, others might never actually work. Don't try and do all of them. Actually, we suggest just selecting and testing one change that might lead to improvement. Then work with your local team and patients to see if it leads to an improvement. If it does, then keep doing it. If it doesn't, make a change or try something different. This approach is supported by the Model for Improvement and the COM-B. If you want to know more about these, links are available in references of this unit. To improve how we provide post-discharge nutrition plans, we need to focus on building knowledge, skills, and understanding. This is called improving capability. Start by helping staff understand why nutrition after discharge matters. For example, make sure that the physiotherapists are aware that malnutrition can slow down physical recovery and increase the risk of harmful falls. Also, check that occupational therapists are aware that malnutrition can slow down functional recovery and reduce the number of days people are able to spend at home. When staff know this, they are more likely to make sure nutrition care is continued after discharge where required. Staff also need to know how to complete the plan and how to explain it to the patient and family. It can help to show how to use electronic systems like discharge forms or EMR templates to make this easier. Simple tools like checklists or templates can guide staff through the steps and reduce mistakes. Training should also include real-life examples. This helps make the learning relevant and practical. Practicing through role-play or simulation can build confidence, especially in explaining the plan clearly and handing over care to the next team. To improve how we provide post-discharge nutrition plans, we need to focus on building knowledge and skills of patients, carers, and ongoing care providers. First, we should make sure patients and their carers or family, where required, understand why better nutrition can lead to better outcomes. Also, encourage patients to ask for their nutrition plan before they leave the hospital. This helps patients understand what to eat, what supplements to take, and who to speak to if they have questions. We can also ask patients who they think would be the best person to support their nutrition care after discharge. It might be a family doctor, nurse, dietitian, or community health worker. This makes care feel more personal and connected. Finally, we must train primary care or community teams so they know how to follow up and support people who are at risk of malnutrition. This could include things like checking weight, reviewing food intake, or following up on supplement use. By building knowledge and confidence across all parts of the care journey, we give patients a better chance to heal and stay strong after they leave hospital. Sometimes, even when people have the right knowledge and skills, they can't do the right thing because the systems or environment make it too hard. This slide is about creating opportunities to make it easier for those working directly in the wards or clinics to provide and use nutrition plans when people leave hospital. Some places might choose to identify nutrition discharge champions, people who lead and support the process. We can also help by assigning clear roles for who needs to complete, explain, and give the nutrition plan to the patient or carer. A lot of places make sure all those at risk of malnutrition receive written and spoken information in a way that they can understand. You may consider including nutrition plans in the normal discharge paperwork templates. Including nutrition as a standard agenda item can be helpful in discharge meeting agendas. Getting feedback from patients, carers, and staff can help make these processes even better. Beyond day-to-day ward work, there are other opportunities to improve the completion rates of post-discharge plans for people who are at risk of malnutrition or already living with malnutrition. We can also make it easier for staff by adding prompts or automatic forms into the computer systems they already use. Policies and procedures should clearly say that patients with or at risk of malnutrition need a plan for their nutrition care after discharge. We can also help by assigning clear roles for who needs to complete, explain, and give the nutrition plan to the patient or carer. It's also important to identify any opportunities to make the plan visible, not only to those in hospital, but outside of the hospital, so all the relevant care providers can see and use it. Working with patients who have been discharged, their carers, and community healthcare providers like GPs, physiotherapists, and home health or aged care teams is key to making the plan work in the community. Finally, we need to include links to local community resources and support services. This could be information about home-delivered meals, community dietitians, social support programs, or primary care follow-up. Giving people the right contacts and support helps them continue good nutrition care after they leave the hospital. Sometimes, even when people know what to do and have been given opportunities to do it, improvement still does not happen. People also need to feel that nutrition planning after discharge is important and that their actions can make a difference. This slide is about how we can motivate staff to care and take action. We can start by looking at ways to build team accountability. Set team goals. These goals should encourage people to use nutrition plans for patients leaving hospital. We can make the work more meaningful by linking each patient's own goals with their nutrition plan. Then we can check and report how often the plans are used. It also helps to show team progress on a visual display, like a poster or dashboard. This can build friendly competition and teamwork. Celebrating success is important too. We can recognize staff or teams who are doing a great job with nutrition planning. Individuals and teams can also be motivated by sharing why nutrition planning and transfer of care matters. We did mention it before, but again, you can increase the motivation of staff, patients, and carers by making sure they know why having a post-discharge nutrition plan can help people recover better and stay well after they leave hospital. Role models and senior leaders can talk about why this matters as well. Real stories from patients, carers, or community health workers can also inspire others to act. Even small things like patients or carers saying thank you can remind staff that their work makes a difference. Many people can play a role in improving nutrition care after patients leave the hospital. On this slide, we've listed a few key groups who can really make a difference. Clinicians are not only responsible for delivering good care during the hospital stay, they also share responsibility for supporting long-term outcomes and helping patients meet their goals. Nurses, doctors, allied health professionals, and clinical assistants often work closely with patients and carers to plan care. They also provide day-to-day support and reminders. These groups are well placed to make sure post-discharge care plans are completed to help care continue beyond the hospital or rehabilitation centre. IT and electronic medical record teams can help by adding prompts or templates to support easy and consistent nutrition planning. Safety and quality teams can include nutrition care in audits and improvement programs. Policymakers set the rules and processes that guide practice. Funders help ensure the resources are in place to support nutrition follow-up. There are many others who can also help. However, these groups are in a very strong position to lead change that makes nutrition planning simpler for better nutrition and better outcomes. There are many points across the patient journey where we can improve post-discharge nutrition care. Discharge planning should start from admission. Don't wait until the day before discharge. One key moment is when malnutrition is first identified. This is a great time to start planning ahead. Also, a very good strategy is that the draft discharge plan is automatically updated any time that the nutrition status or care plans are updated in the electronic medical record. Daily team meetings, goal-setting sessions, or therapy reviews also offer chances to embed nutrition into care planning. During conversations with families or carers is also another great time to consider the post-discharge nutrition plan. Transition reviews and discharge planning discussions are all natural opportunities to include nutrition support. After discharge, improvements can continue during handover to community services and primary care visits. These touch points are already part of care. We just need to use them better. There are many important times to talk about nutrition care as the patient leaves hospital and moves to the next stage of recovery. First, we should include nutrition planning during transition or case management reviews. This is when the care team meets to plan next steps. It's a good time to check if the patient still needs nutrition support. Next, we must talk about the nutrition plan at the time of discharge planning discussions. This helps the team know what information the patient and carers need before they go home. We also need to share the nutrition plan during handover to rehabilitation or community services. This makes sure the next team understands what nutrition care is needed and can continue the plan. Finally, we should follow up on nutrition care at outpatient or primary care appointments. This helps to check progress, answer questions, and update the plan if needed. These touch points are already part of care. We just need to use them better. When we talk about nutrition at these key points, we help patients recover faster and avoid problems after discharge. There are many places in the health system where we can add or improve nutrition planning after a patient leaves hospital. Some of the most helpful places are the documents and forms used in discharge planning. We can also use electronic medical records and other computer systems to add prompts or reminders. Staff orientation and education sessions are another good place to talk about nutrition planning and show people how to do it well. The same goes for team meetings or case conferences. Handover checklists, journey boards, and audit tools can help keep track of who has a nutrition plan and who still needs one. We can also use quality improvement and registry reports, memos, and conference posters and presentations to share progress and ideas. We can make changes to hospital policies, protocols, and care pathways. Finally, a very powerful way to drive improvement is to make changes to how funding agreements and reimbursement processes are applied so that they reward good practice. There are lots of moments when and where we can make sure nutrition care continues after discharge and becomes part of normal practice. We just need to notice them and make the most of them. Don't make it too complicated. Keep it simpler for better nutrition and better outcomes. We invite you to watch this short 3-minute animation. It shows the difference simpler improvements can make. His journey shows how early nutrition care can really help. Even if you've seen this video in another unit, it's worth watching again here. It might be helpful to look out for the things you've learned in this unit. It's time to reflect again. What are 2 or 3 realistic changes you think could improve the use of post-discharge nutrition plans in your setting? These could be changes that influence capability, opportunity, or motivation. Also, think about who could be involved, when and where the change could happen, and why the change is important. Just put in a few of your thoughts. This is not assessed. It is just to get you thinking. Once you've finished your reflection, you will then see some useful links to some additional resources. After that, please make sure you complete the short quiz to check what you've learned in this unit and to give us feedback about the unit.